Good morning, everyone. Thank you for registering for today's High Notes webinar, where we've invited Dr. Verlinda Henshaw, Executive Director of SIH, as she's going to talk to us about workers' comp spending, tips to avoid spending too much, and best practices when dealing with claims overall. So with her 20 years of experience, she's an expert in this field, and we're so excited to have her this morning. Again, if you're attending today, you'll receive a recording of this webinar, and also Higher Level is going to provide 1 SHRM credit for you. So you'll receive an email with that unique code following the webinar. So with that being said, I'd like to introduce Verlinda to everyone, and we can get started.
All right. Well, thank you so much, Emma. I really appreciate you asking me to speak today. This is obviously a topic that's near and dear to my heart, and I love that you said 20 years because it's, I think, on the upper end of the 20 years of work that I've done in work comp. So I'm really, I'm always amazed. I'm always learning about opportunities in work comp and what we can do. And my background is as a doctor of occupational therapy. I have worked over the years by treating workmen's compensation patients, as well as doing ergonomics and a variety of involvement with many different companies throughout Southern Illinois to really try to help them reduce their workers' compensation claims and then help navigate when there is one. And so over the years, currently my practice is with SIH, and we have SIH Work Care, and that is a occupational medicine facility where that is our sole focus, is to help companies reduce the number of claims as well as take care of their employees when there is a claim. So to get started today, I think just wanted to look at, the outline of what we intend to talk about over the next hour, and that is, what is the impact to employers and small business with a workers' compensation claim? What are the opportunities do you have as an employer to reduce the impact? And that is through several different mechanisms, whether it's pre-planning, pre-employment, injury, and then injury navigation. So we will jump right in. If you have questions throughout the presentation, please put them in the chat, and Emma will prompt me. I have no problem talking for an hour nonstop, as many of my associates as well as my husband will tell you. So yeah, please don't hesitate if there is a question to put that in the chat, and I'll try to answer it to the best of my ability. So let's talk about why are we talking about workers' compensation? Why are we talking about this? And what is the impact that any kind of workplace injury has to the employer? And essentially what you may, hopefully you don't know, but what you could find out is that injuries and illnesses that happen in the workplace really impact the employer's bottom line. Employers throughout the United States pay almost $1 billion per week for direct workers' compensation costs alone. And these direct costs are related to actually compensation payments to the employees, payments for medical expenses, costs for legal services. But beyond that, there's this whole world of indirect costs that really are impacting employers, and that is, if you have an employee who's injured, then you have a training and replacement of employee. You need someone to take over those duties while that person is off. There's also an extensive amount of time and energy spent on looking at how the accident happened. How do we keep that from happening again? What is our opportunity to get damaged equipment fixed and productivity? So lots of impacts from that one particular injury could be very costly, much more than just those that are directly related to, and some of those we forget about. So when we actually calculate that cost, it starts to grow. as there is an injury, we talk in terms of DART rates and MOD rates. And what our goal in an OCMED program and for employers to really manage workers' comp, the idea is if you can keep your DART rates down, then you can reduce your premiums. Those DART rates are those days away from work, restricted work, or transfers to another job. We may not be able to limit all of your restricted work, but we certainly can reduce, and some of the ideas that we're going to talk about today are truly meant to make a difference with reducing those DART rates. We look at OSHA recordable injury as any work-related diagnosed case of cancer or chronic irreversible disease, any work-related injury resulting in a punctured eardrum or fractured/cracked bones or teeth, any work-related injury or illness requiring medical treatment beyond first aid. And I think that's a big key right there that we really try to play on, is that beyond first aid. How can we provide first aid? So when you look at an OSHA recordable, and I always laugh because, you know, we have people who go get injured, they go see their own doctor, and the doctor will send them, you know, tell them, oh, we're going to put you on prescription Tylenol. Big no-no, right? That's an OSHA recordable. A prescription Tylenol is 800 milligrams. When you buy it over the counter, it's 200 milligrams per pill. So take 4, it's over the counter. So there's some things that physicians and medical practices can do if they understand the nature and the lay of the land for a work-related injury. And obviously any work-related fatality would be considered a OSHA recordable. I love when I talk to employers and the ignorance is bliss, or I hear a lot from employers, our insurance company handles all that. I don't really deal in that. And really that concept for a small employer, or really any employer, can be highly risky. It can be very expensive, and it can actually haunt your business well into the future because those claims can last a long, long time, and they can really impact what you're paying from a insurance standpoint for several years. It's unlike a fine wine. Workers' compensation claims do not improve with age. It's exactly the opposite. The longer they go, the more significant those claims will get. Your immediate response to a workers' compensation claim can make the difference between a very low cost injury and a $150,000 claim or more. It's really up to how that employer handles the claim. So we talked about in the beginning, one of the strategies is pre-planning. Pre-plan those injuries. Have a response team in place to immediately strategize when a claim occurs. What's going to happen? Who's going to be involved in this? And whose responsibility is it to handle things? You have an HR manager or an HR department. If you don't have an HR manager or department, what does that look like for your company? Who's going to handle that? Is it the department supervisor? It might be the company owner, as well as, do you have someone identified? You know, a lot of smaller companies don't have legal counsel. They don't have, so who is that person if you do need legal counsel for an injury and need to protect yourself? Who are you going to use? What does the plan look like, and what's your policy? One of the things that I've seen is a lot of companies don't have a policy, so employees could get injured today and they don't say anything. They don't tell their managers, they don't tell a supervisor, and 3 weeks from now, they come up with a claim and they say, well, you know, 3 weeks ago I hurt my back. But there should be a policy in place that requires that employee to report that. It's not that you may or you may not, you may deny the claim. If they violated the policy and they didn't let you know and they didn't report it in a timely manner, then that's grounds for you to deny it. I'm not saying it will continue to be denied once if they, hire legal counsel and establish it later on, but at least you've got a policy in place. You want people taken care of, and you want to know about that claim as soon as it happens. We don't want people to drag that out. The next thing is, who is your first aid provider? Who is the medical provider that you can find in your community and near you that is specializing in workers' compensation, who understands what an OSHA recordable is and what makes an injury an OSHA recordable, kind of like the Tylenol example that I used previously. The other thing is, be familiar with your work comp policy. And do you have access to a preferred provider program? And we'll talk more about that later in the presentation. The pre-planning also starts with the hiring process. How do you hire people? And if you're hiring right now, kudos to you. If you've got applicants, great. And that's a celebration, because many of us, I know everyone is across the country is struggling with, finding, let alone qualified applicants. Just getting any applicants has been a struggle. So, how do we make sure, and this becomes tricky in this culture, like in this time, how do we make sure that the people we're hiring can actually do the job? A culture change, that is something we see a lot of. I've seen lots of companies and municipalities that the culture, they don't manage those work comp claims. There is no structure around that. There is no pre-planning. So when an employee gets injured, they're off for an extensive amount of time. And, we are about into what we call the fall claim season here in Southern Illinois, because it's about to be deer hunting season. It's about to be bow season. And invariably, over the years with this culture, people knew if I have an injury, I'm going to be off work. How can we change that? Light duty and some other things that we can put in place could change that culture. And again, those types of claims end up costing you lost time days. The other thing is provision of quality and efficient medical care. When I talked about in the last slide of pre-planning, finding you someone who understands workers' compensation, it's also about quality care. You want someone and you want a process that people are going to take the very best care of your employees. Someone might do it cheaper, but if it's not the best, it's going to cost you in the end. You want to make sure that they get the very best. Efficient medical care, again, we don't have time to wait around for referrals and authorizations. And a good example in my organization, there's oftentimes we call for an MRI for an injured employee, and they're 15 days out. Well, that's 15 days of lost time days for that employee and that employer, and that's unacceptable. If we have an injured employee, we need to get them taken care of now. We need to know what the MRI says. We need to be able to make a determination about whether or not, what's the next step, and whether or not they can safely return to work. So being okay with a 15-day wait on an MRI is unacceptable. And if that means our system doesn't get the MRI, that's okay. We're going to go to the first available MRI, no matter who owns it. And, the other thing is communication. Who's going to communicate not only with your injured employee, but who's also going to communicate with the medical staff? Who's going to call and make sure that we're doing those things that need to happen, and making sure that, we understand everyone's on the same page, and also making sure that that employee is well taken care of and that they're okay. Sometimes that little touch of just how are you doing? I'm just calling to check in on you can really make a difference. It makes that employee feel taken care of. It makes them feel like the employer cares, and it really can change what the outcome of that claim looks like in the end. So all of this, really, one of the first starting points is the hiring process. What can you ask your applicant? Well, you can ask the applicant if they're aware of any factors that would limit their ability to perform the essential functions of the job. Now, when we talk about essential functions, I want to make sure everyone understands what those are, because the essential functions, it is, would I have to hire someone else to do that part of the job? If you use that question, that's a major function. Like if I couldn't do my job, is my employer going to have to hire someone else to take over for me? And which part? Which part of my job? So that's an essential function. And that's a critical piece when we're talking both ADA and EEOC. You know, any of these hiring processes have to be ADA and EEOC compliant, and understanding what are the essential functions of the job is critical. So if you don't have a list of essential functions for your job, we're going to talk about how to get that. The next thing is show the applicant how to perform the job and ask if they can perform those essential functions. Have the applicant perform the job to see if they can do it. So again, if it's all around the essential functions, if it's all around what you've established and you've answered these questions, and again, have some documentation around this, then that's a critical piece. When employers are ensuring that they can that the employee can complete the physical job demands, typically what we see in a typical hiring scenario is a lot of companies say, well, we want to do a medical physical. That's the only piece we do. We just want everybody to get a physical. We want to make sure they're healthy. Okay, so what if they're not healthy? If they're not healthy and they still can complete the physical demands of the job, then we have no basis not to hire that person. Okay, we can't utilize that information as a company. We can't utilize it against them for their health insurance or to not hire them. That's why these tests are done post-offer. So as a company, you interview the applicant, you decide to hire the applicant, you make the job offer contingent on being able to perform the job demands. So they go to the physical, they see a provider, and what we recommend is we actually recommend to do a post-offer test, a post-offer physical test. This allows them to perform those essential functions of the job and see whether or not they can meet those demands. If they can't meet the demands, then we have to go back and say, can reasonable accommodation be made, or is this an essential function? So the other thing that happens with this type of testing pre-employment, and I have lots of employers that say, oh, that's way too expensive. But here's what happens. You also develop baseline data from the time they were hired. So if you've done a pre-employment test and a post-offer test, and 2 years down the road, your employee, and in that post-offer and in that physical, they were able to complete all the demands of the job. There was noted that the patient wasn't able, or the employee wasn't able to raise their arm past 120 degrees of shoulder flexion. They couldn't actually raise their arm overhead, but it didn't stop them from doing their job. So, 2 years from now, when there's an injury to that right shoulder, you're not, as an employer, paying to rehabilitate that employee back to 120 degrees, nor are you responsible for that extra, if they get to 110 degrees, you're not responsible to get them to 160. You're responsible to get them back to 120. And that could impact your impairment rating if no other impairments exist. And if they started at 120, you got them back to 120 and they can do the job, what is the impairment rating for determination of a work comp settlement? So some of the terms I've used is a job demand analysis. And this is where you have an on-site analysis of the most physically demanding aspects of the job. You can use this report. Someone would come in and do this type of analysis. It's written up and it can be utilized as part of the job description for the employer. It's that detailed information. The post-offer employment test is administered to new hires to determine if they meet essential functions of the job. That's where, once you have completed a job demand analysis, a post-offer employment test can be developed. The other thing is a fit for duty test, and this is the same test as that post-offer employment test. And this is administered to people who have been off on FMLA, work comp, or any type of personal medical, and it's completed prior to returning to full duty. And I'll give you an example. You have to do the job demand analysis to develop the fit for duty and post-offer test. So a good example of a company that I worked with, this company didn't have these things in place. And they had an employee who had injured his back on his own time, personal medical, off for a couple weeks, saw family practice, saw the chiropractor, pain got better, and he was released to return to work. And actually, I was on a board for this particular company, and I said, we really need to have, do we have job demand analysis? Do we have a fit for duty test? No, we don't use that. We have a union contract. It's not in there. I'm like, you need this. You need this. This is scary. This guy's had a back injury. So 2 weeks after returning to work, during the course of his employment, he was working with another coworker, and they had to lift a couch and move a couch. And when he did, he re-injured his back, and ended up with a 3-level full disc herniation, had to have surgery for a 3-level fusion, and ended up with full disability. So what could have been avoided by a fit for duty test ended up being over a $2 million disability claim. And so there are big implications, and some of these things they are minimal cost to the company in the grand scheme of one injury. So the job demand analysis is really a foundation of any injury and of any program. I tell people this all the time. This is where people get, after we talk and we lay out all the options, where do we start? This is where we start. It is that foundation. It is a listing and a job description outlining the physical activities of an occupation. As a medical professional, I can tell you, I have employees come in who are injured all the time, and I say, so what do you do? Well, and a good example is a roof bolter. Well, I'm a roof bolter, and really, so tell me what that entails. Well, they have these roof bolts, and they weigh 30, 40 pounds, and I have to lift that overhead. Really? And how often do you do it? Oh, I do it all day long. It's just constant. It's constant. And I'm like, okay. So when they actually find out, I've been underground, I've done a job demand analysis on a roof bolter, and I understand that actually it's not continuous. It is lifting. It is the roof bolts typically weigh about 10 pounds, depending on the manufacturer. They can go up to 12. And it only lasts a few seconds at a time. Now, if we add up how much you're lifting, so if we add up those few seconds at a time, it comes out to be an occasional overhead lift. So these are things where we look at sitting, walking, carrying, pushing, lifting, standing, fine motor, all of those things. We classify things as constant, frequent, occasional, and never. And a good example, when I was in training and we were talking about understanding these levels of classification, someone said to me, what classification, if we were talking about a Major League Baseball catcher, how often, what do you think the frequency or the duration of that catcher is for squatting and of their work day? And I was like, well, gosh, that's really got to be, it's somewhere between frequent to constant. I would say frequent. It's definitely frequent, 1/3 to 2/3 of the day. So we did an analysis of that catcher position, And truly that position was, they were in this position less than, really way less than a third. They're only squatted for the pitch, then they stand, then they squat. They're only there up to about, in that position in a sustained manner for really about 2 to 4 seconds at a time. And they do it repeatedly. So if we added that up over the course of a game, it still only came up to less than a third of their day, because the rest of the time they're in the dugout, they're at bat, they're running, or they're standing, waiting for the action to happen out in the field. So it really opened my eyes, and that's been the best example that I've been able to use when talking about, because if a catcher came in, what they would say to that medical professional is, "Oh, I frequently squat." Well, in actuality, no, you don't. So having that data is even more important, not only for your pre-employment testing and all of that, but if you do have an injury, any medical professional that talks to your employer or to your employee, any medical professional that's treating your employee needs access to that. So the testing itself, the pre-employment medical physical, it's basically, are they medically fit? It doesn't mean you can't hire them, but what are you hiring? The post-offer testing is hiring the right people by ensuring the employee meets those physical demands. And these are, some examples, like for a coal miner, can the potential employee lift, push, pull, and carry 100 pounds? Can they crawl under low surfaces? Can they kneel? A bank teller, can the employee stand for a prolonged period of time? Can they carry and install or exchange money from the ATM machine? That's a little bit more. How much money? What does the bag usually weigh? What's a typical bag? What's the heaviest bag they would have to carry? So having some of that data, again, will help you. Once they have done a job demand analysis and we are in the process of developing this test, the person who comes in to do this can not only, they will document very clearly the test development based on those job demand analysis. They then validate the test by bringing some of your current employees in, having them go through the test, and make sure that they have documentation. Yes, this is very similar to what we would do at work. And they document the rationale and the sequence of the test development. Again, this is critical in the event that you have someone that you're turning down for employment based on their inability to meet those demands. This will ensure that you are meeting the EOC and ADA guidelines. And the person who's developed your test will be prepared to go to court with you and defend the test development and the test that they did for you. So on average, 1 out of 10 tests of these post-offer tests identifies a potential injury and savings of $50,000. The cost of setting a test up, doing a job demand analysis for even if it's just one position, and then doing the incumbent testing and the test development will run around $600 to $700. And that would be for maybe an entire department. Culture change, the biggest thing I can tell you is if you do not offer light duty or transitional duty, you should consider it. Keeping employees at work, the studies have shown that the chance of an employee returning to work after an injury is directly related to how long they are out of the workplace. Any capacity that you can bring that employee back within 3 days will positively impact your mod rate, which is critical. Carriers are likely to only count 30% of the claim toward a mod rate, so you get a 70% reduction on impact if you can bring them back within 3 days. And again, making sure that that provider and that medical provider understand what those job demands are, so and not writing off work or not writing limitations, but actually saying this is what your employee can do, and you having opportunity. And I've had companies I've worked with who had people sort paper clips. I mean, that's probably not the best use of their time, but it can be things from filing. It can be, you know, just observing things, training, doing orientation, things that doesn't require them to, that will allow them to work within the physical demands that they are able to do. Again, proactive health initiatives. This is a culture change. These are things like smoking cessation, weight loss programs. These are not always your employee favorites, but a lot of companies are offering incentives that can offset so the employees do buy in, and over time you could change your culture, and you can impact the health of your workers. That not only reduces your work-related injuries, but also can reduce those healthcare claims. Again, quality and efficiency is critical. We need to change the work comp culture in your business. Quality healthcare means fewer lost time days, better outcomes. That's where we really need to make sure, and I can't hone in this enough. Again, establishing this relationship with your OCMED provider and specialty services, not just who are you going to, but man, when we see companies come in a lot and they send their employee for first aid, and we see them, and then an employee has the opportunity to go see their own doctor, but we've already established a plan. We've already established, and if we do a good job as the OCMED provider with that employee, they typically aren't asking to go anywhere else because they felt very taken care of. They felt like they were understood. And you know, those with those injuries, you know, do we have people who come in that are maybe not as injured as they seem, or they have a little magnification? Sure. But the processes that we have put in place, I think, help deter that. It's a process. A good example, it says, why would you see a cardiologist for a muscle strain in the arm that's work related? Well, you wouldn't. So that's the same thing. Why would someone go to another provider, a family practice provider, when this is actually a work related injury and we should see a work specialty provider? That provider needs to know and understand your business. They need to know the physical demands. You can ask to meet with those providers. You can ask the providers, invite them to your work site so they can view it. A lot of times in those job demands, we actually video the jobs, the individual jobs, and a lot of companies will save those videos and they'll ask us to send those to providers. So if you have a person who has an injury and they need to go to, you know, they need to be seen by an ortho specialist, it's really a great tool to be able to send that orthopedic specialist a video of that particular job, so they know what's happening, what types of equipment they're working with. And then we also can put in that job demand analysis with that video so they understand what's happening. Drug testing program. This has been, it's almost it's a catch-22. In Illinois, obviously, with legalizing marijuana in the state has changed a lot of our landscape. Prior to legalization of marijuana, you know, I think we were limited a significant amount previously of who we would have people come for interviews. Oh, I have to take a drug test. Never mind. You know, they wouldn't come in. I don't think they were impaired during the interview at all, but I think they had, you know, because it stays in your system, they obviously weren't passing the drug test and we were passing them up. It's those other drugs that are pretty significant. Like, I'm pretty sure I'm not sure. I don't always just need a warm body to fill a job. I don't want somebody in here who's, you know, on meth or doing cocaine, or maybe using opioids that are not prescribed for them. So one of the things you need to really look at is, what does your policy say? Because the key is they cannot be impaired at work. And then what does that impairment look like? Do you think that pre-employment testing for those other drugs and those more significant drugs that are illegal is still a key factor in making sure? The other key in Illinois is that if there is a work comp injury, and I love this because I have people do this all the time. I'll have an employee come in and they go, well, I got injured at work and they tell me I need to come here for a drug test. Okay, so who brought you here? Oh, no, I drove myself. The key is too, what if in that same time frame after an injury in Illinois, if they are under the influence and you can show that they're being under the influence at the time of the injury was cause of the injury, then it's no longer a work comp claim. So if that impairment from being on drugs or alcohol is the cause of the work comp claim. And a good example I use this is if you're going on a work trip and you get on an airplane and you have some cocktails and the airplane crashes, and you're the passenger, then that's still going to be a work comp claim. You're considered to be at work, you're in and out of the course of your employment, and you're okay. I said you were a passenger. If you're the pilot, we have another conversation, because then the crash is probably due to the fact that you were impaired, and therefore the pilot isn't going to receive workers' compensation, and family and everyone isn't going to receive workers' compensation for that particular injury. So having a policy around what are we doing pre-employment, what are we doing with random testing, and then the next step is who's bringing that person to be tested. The employee I talked about who showed up without a supervisor said, oh yeah, I was injured at work. They told me to come here, get seen, and get a drug test. That's all fine and good, except what is, if they're positive, I have had employees who said, oh yeah, that hurt really bad. So on the way over, I smoked a joint on the way over, so I'm good. I wasn't impaired. I wasn't impaired when I had the injury, but on the way over here, the pain was bad, so I took care of it. That's the kind of thing that we need to avoid. So if there is suspicion, what does your policy say about suspicion? Who is responsible for driving that employee to a drug test to get tested for a suspicion? Again, in Illinois and in some of the states that are legal for marijuana, we still have to consider if there are any federally regulated employees, or if you have contracts or grants that are federal, because it is not recognized as legal under the federal system. So you may have employees who have DOT, their CDL license, that are regulated by the Department of Transportation. And those people would fall under the federally regulated. So they do have to undergo random drug testing and pre-employment testing, and marijuana would not be acceptable in those instances. So what happens if you have an injury? We've talked all about all the things that we could do to set us up so that hopefully we're hiring the right people. The other thing is, maybe doing some ergonomics. I didn't talk a lot about that. We could spend a whole nother session on ergonomics and what that looks like, and having someone come in and make recommendations to have a safer workplace through an ergonomic evaluation. But let's just say we've done everything right up to this point, and again, something happens and the employee gets an injury. So what should you do after receiving the notice? Again, you want to provide necessary first aid and medical services. You want to accompany or drive your employee. Think about that reasonable suspicion of drugs or alcohol. It's not, it's not acceptable in the state of Illinois to do a reasonable suspicion on everybody. However, we just need to document. We need to document why we had reasonable suspicion. Well, there was no reason for the accident to happen, so we're questioning impairment. Eyes were red, speech was slurred, those types of things. The next thing is, you're going to inform your insurance carrier or workers' compensation administrator, even if you dispute this employee's claim. You want to take them and get first aid medical services, and then you want to let your insurance company know. Then you want to investigate. How did it happen? Has it happened before? Are there any witnesses? Get employees' signed statement of the accident. On your drive, on the way to get that first aid, it's critical to ask them. We tell our medical providers, when they come in and they sign in, and they're taken back to the room, the nurse that takes them back to the room will say, what happened? And we get details, and then we match that up with, is that the same thing that they've told the doctor? Is that the same thing they told their supervisor? And is that the same thing they signed? We will ask, when you call, if you call our office to bring an employee, we would ask you, what happened? Do you have a signed statement? Do you have a description of the accident? So again, directing emergency/first aid care. And I know this is specific to Illinois, has the option. Many states, if you look at the work comp law in those states, allow directing workers' compensation care. They allow for the employer to decide who they're going to see. Illinois does allow this for first aid care and emergency. They have also this preferred provider option. The crazy thing is, back when they updated the work comp law, we thought this was going to be the saving grace for employers. We thought this was going to be a huge option for everyone to really make sure we weren't getting scalpel happy providers, that we were getting those really good quality medical care for our employees. Yet then they came out with the rules, and the rules made it almost virtually impossible for any single employer to develop their own PPP. But a lot of employers have a PPP option already in their work comp policy, and their work comp carrier may have a PPP option. It could be too broad, but that's something you want to look at. Offering light and transitional duty for employees to remain at work. We've already talked about that. Ensuring that the employees do not get stuck between the referral and the insurance approval. As an employer, and we have this happen all the time, because the employee comes in, they're seen, the employer hands it over, it goes after that initial first aid, they need therapy, they need an MRI, whatever it is, and we can't get authorization from the insurance company. So most of the time, I call the employer back and say, hey, we need you to call your insurance company. They're not moving. You are the policy holder. You're their customer. They should listen to you. A lot of times I can jump up and down all day long, but it's really once we get that employer involved to make sure that we don't get that employee stuck. The medical provider that you choose should help on that referral process. Again, I talked about the MRI. Same thing with getting them into an orthopedic. We have in our clinic, and this could be developed anywhere in the United States. I've actually been around and worked with companies all over the United States to develop their program, do their job demands, get everything set up, and then find their OCMED services that can come in and help them do the testing. I'm obviously maybe across the country, but we can set getting things set up and then finding that provider to be their person is the opportunity. And then progressing through light duty and transitional care as the employee progresses in their care. So this is kind of, to me, it's a no-brainer, but I'm a therapist. So as I treat patients and we watch injured employees come in, you know, there used to be, everyone wanted a FCE, a functional capacity evaluation, at the end of their at the end of their work comp before they return back to duty. So, you know, there's a program out there that allows therapists and really looks at where is the employee every 2 weeks to those job demands. If I have that job demand, I'm going to test your employee every 2 weeks. And there are lots of times your employee is ready to go back to work and they meet the full physical job demands. Or we can move them up in light duty or their transitional duty, the things that we're asking based on their abilities at work, or based on their actual physical abilities. So we want to make sure we're looking at that process and not just waiting till they do 8 weeks of therapy and then go, okay, now we're going to test you and see where you're at. I don't need to test you at the end because I've tested you all along. I don't need the cost of functional capacity evaluation to the employer. We are going to know. And then also it's a good way to identify when that person has really plateaued. And if we're not seeing any movement, it's a great opportunity for discussion between the medical professionals to treat your employee as a team to determine what might be the next steps. Communication between everyone involved is a key factor in this whole process. So being consistent in how you deal with injuries, having your plan, having your policy, and then having those people identified who is responsible for making contact. Again, you want to document how you handle the injury. You want to document every time you have a conversation with somebody. If you have a conversation with the employee, if you have a conversation with the doctor, keep good notes. Have a designated person in your company who's responsible. I know in my company, when we see an employee for a work-related injury, the first thing we do is pick up the phone and call the employer. Thank you for sending your employee to us. Here's what we have going on. Here's what our next steps are. Do you have any questions? And I do that a lot, and we do that a lot of times with the employee sitting right there. We want to make sure everybody's on the same page. The other thing is making sure you're contacting your employee. If they're off, especially in that first piece, you know, if they don't have a lawyer, you know, if they've been injured and they're scared and they don't know what's happening and they don't really know the process, you know, make sure you're having that conversation. Make sure they feel comfortable, make sure they feel like they're cared for, and that they know that their employer is truly worried about what's happening and they want to take care of them. That's how we can keep those claims from extending out and being, you know, mishandled later on. Again, returning to work, whether they're on any type of personal medical or from a work-related injury. Again, we want to go back, and we want to make sure that they can get medical clearance. And what we see is, you know, we have a cardiologist clears them to return to work. Well, does the cardiologist know what the essential functions of the job are? And can they do it? Did they have a heart attack? Did they have these things? Physically, the heart may be ready to go, but if they've been off work for 6 or 8 weeks with something with their heart, they probably are deconditioned. They may or may not be safe to come back and do it, and we may need to work on a few things. So, you know, just making sure that we look at how do we avoid picking up, and how do we make sure our employees are safe? How do we make sure they can do that? And part of that is just retesting them and doing that fit for duty before they return. So I provided some references here that I used for the presentation. Again, this is a topic that there are so iny ins and outs of what happens in a claim and what happens with an injury. So I highly recommend, again, the ideas and the points that I've put out there. If there are questions or concerns, when you get this, my email is verlinda.henshaw@sih.net, and I'm happy to entertain any questions or scenarios that come up that maybe we could help you out with.
Thank you, Verlinda, so much. Lots of good stuff in this
You're
webinar,
welcome.
guys. Again, we will be sending out a recording, and like Verlinda said, you can reach her via email. I'll also include her email in the follow-up text. So if you enjoyed this webinar and want another opportunity to earn some SHRM credits, or just develop your workplace as a whole, we are going to have our next High Notes webinar next month on October 27th, where we're going to have employment attorney Andrew Metcalf cover the updates on COVID-19 workplace vaccination policies. So I'll also include that registration link in the follow-up email following this webinar. So thank you all so much for joining, and have a great day.